Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Time again now for our weekly update. This is being recorded on Sunday morning, and please share this video with someone you care about. And in this video, return to the pod and the numbers, trending in a good direction, although not quite where we want to be yet. So a couple weeks ago, the lid was really jiggling, fueled by summertime, traveling, gathering, not being as careful as possible to avoid crowds, distance when possible, wearing a face covering when not, people putting themselves in harm's way. Maybe not boiling over, but certainly headed in that way. And it wasn't just the outbreaks and clusters here, but also spread the community at large. But due to many more choosing to join with those of you who continued your good efforts, due to learning how not to be a close contact, so if someone you were around turns out to be positive, your life wouldn't be disrupted, and to those who were a close contact demonstrating a COVID IQ, isolating if sick, and quarantining when advised. Even with the heat turned up, the lid is now much calmer, but not fully calm. And this is reflected in our numbers. We can see here the total number of cases have come off its rapid exponential rise, now 483. That's an increase of just 28 from last week when there was an increase of 62. And of those 28, only 6 related to Silver Bluff and none among hospital staff. This is a trend that started back on August 10th and has continued now for 13 days. So we can feel more comfortable that this is real. The COVID working number, those in isolation and quarantine, fell way down as well, from 363 to 255. But looking at the past few days, hopefully this has not stalled out. A key metric is the percent of positive tests, and as you may recall, below 5% is an important threshold. In Haywood County, we're in that 4 to 5% range. North Carolina, however, ticked up a bit this week from 7 to about 8%. And visits for COVID-like illness in Haywood County continue to be up. More people getting tested, but fewer are positive. And this may represent the beginning of other viral illnesses that show up in the fall. The decrease in new cases here tracks nationally. It's also true for surrounding states, as you can see just a couple in the red zone now. Although the number of new cases and deaths in many of those states is still very high. True also for North Carolina, but note an upward change near the end of the week. Now, the 7-day average of new cases per 100,000 population is a very telling metric. And again, we're looking to be below 6 and ideally below 1. You can see here North Carolina down to 12.4, Haywood down to 6.6, and look at Jackson now down all the way to 1.3. Swain at 4, Graham at 8.5, but Macon, Buncombe, and Henderson, although still in a good zone, all each ticked up a bit this past week. For Haywood County, we were all the way down from a high of around 29 a few weeks ago. But again, note the flattening in the past few days. Prevalence in Haywood County now looks to be in the 4 to 5 per thousand range. And recall that schools have opened successfully in other countries when that prevalence is below 5 to 7 per thousand. So what does all this mean? Well, the window of opportunity remains open. We're on a good trajectory. But this is no time to let up on your attention or diligence. We are not fully down to where we need to be for in-person learning at schools to be their safest and to be prepared for the next spike, because there will be a next spike. And we have not yet demonstrated we can maintain our gains, and we need to be able to do that. So what you do really matters. The past 2 to 3 weeks demonstrate that, because the numbers we see now reflect what you've been doing since then. The more on board, the faster we can get there. So be well and be careful, especially right now.